Okay, we're here at the Chatbot Roadshow. I'm Greg. I'm here with Justin and Kelly. Guys, thanks for coming in today.
Thanks, Greg.
Thanks for having us.
So we're going to do a little demonstration of the referral management bot solution, specifically as it relates to ED discharge to a PCP. And so, Justin, before we start, maybe you can describe specifically what we mean by that.
Yeah, referrals are really the connective tissue of any hospital system. And ED discharge is one of the largest highways, if you will, in a hospital system. People that are discharged from the ED are often referred to PCPs or specialists. And at a large hospital system where you have 2 or 3 EDs, you might have 100,000 PCP referrals per year. And the crazy thing is that up to 50% of those are not followed by patients. Maybe 25 out of those 100 patients end up going outside of the hospital system if they already have a PCP or find one online. And the other 25 never follow up. So if you're a hospital, it's a big problem because those patients are more likely to get readmitted to the ED. And it's also lost revenue, right? You have these referrals that you wanted to keep in network, and that prize can be worth $8 to $10 million if you're a large hospital system.
Right. Okay, so let's take a look at the process and what's wrong and what we're trying to fix here.
Yeah, so today's referral process is not a great experience for patients. We force a lot of the work onto patients. So if we take Kelly, who's recently been discharged from the ED, there are a lot of hoops that she has to jump through.
Yeah, I've been to the ED a few times in the past, and I can say from personal experience that, I'm already in the ED for far too many hours than I would like. I'm sent home with a huge stack of paperwork. The print is oftentimes very small, and I'll be the first to say that my eyesight isn't great. So realistically, I'm putting those papers on a side table and probably forgetting about them until spring cleaning, at which point I'm recycling them. I don't know what I should do next. I don't know if I need to do something next, and I just don't know.
Yes, of course, and this is all in the context of healthcare striving to deliver a modern consumer experience. So the whole concept of doing this via chatbot on a mobile device is what people are expecting to do versus small font paper, as you were describing, Kelly. So we're going to focus on 3 different areas. I feel a little bit like Alex Trebek in Jeopardy here, but we'll show you how to manage patient leads. We'll get into autofill magic and one-click scheduling. So let's begin in managing patient leads. How does the referral bot handle that?
Yeah, if you're an ED that's dealing with hundreds of thousands of patients a year, you want to reach out to all of them, but you only want to reach out to the people that were sent home out of the ED. You don't want to reach out to the person that was admitted to the hospital for heart surgery to see if they have a PCP or not. So the first thing a chatbot has to be able to do is understand exactly what happened in that clinical event with the patient to make sure that their disposition status is that they were sent home, not that they were admitted to the hospital. And if you're a big hospital system, that type of discernment is the first foundational layer that you need in order to reach out to any of your patients.
So with LifeLink, there's an alternative, like Greg said, to that huge stack of paperwork that I'm leaving on my side table. I'm at home, I'm trying to rest. I get a text message and it knows that I'm sitting at home and I'm not, like Justin said, waiting for heart surgery. So I actually am interested. So this is fantastic that it can reach out to me and remind me what I need to do. Because it is likely that the ED physician told me something, but in the craziness of an ED, I didn't really catch all of it. So yeah, I really actually am interested in following up with a PCP. I do care about my health. It pulls in from the EMR a PCP that I had on file, but in all honesty, I haven't seen this PCP in 3 years. Since then, I've moved. So I actually don't currently have one near my home anymore. So I'll click I don't currently have one.
All right, so you can imagine that the hospital system has reached out to thousands of people like Kelly to see if the PCP on file is actually correct, and if they don't have a PCP, if they want help securing one in network. So now the hospital system has a really targeted list of patients that they can work on to retain in network.
Right. Okay. So then if we move on to the next section of our demo, autofill magic, this whole notion of repurposing data, how does that work?
Yeah, we've seen autofill everywhere else in our lives. We don't have to put in our credit card information every time we buy something. And it's crazy that when you want to book an appointment with a hospital system, you go to the website and you're staring a form like this in the face that has 30 or 40 fields. And most of those fields are things the hospital already should know about you. In fact, Kelly probably told the hospital all of this information yesterday when she was in the ED.
Yeah, so I would like to see a doctor closer to my home. The bot is showing me my address, the one that I provided to the ED staff when I was there last night. And so I'll say yes. And then it looks like it selected a provider for me, which is great. I know in the past when I've looked at hospital websites and web pages, every hospital has a find a doctor page, and they may vary hospital to hospital, but they often are a list of provider names, a list of insurances, and a list of locations. From my perspective, I'm not sure how to navigate that, what to prioritize, who is accepting new patients, and who's going to be close to my home. So the fact that this is able to show me one provider is great, and it reduces all the friction required on my part to make a decision and follow up with a provider.
And you can imagine reducing that choice paralysis for patients has a huge impact on the number of patients that are more motivated to follow through with their referrals.
Okay, so you found your doctor. You want to see that doctor. And this gets a little bit cool because this whole concept of one-click scheduling is bleeding edge.
Yeah, so today a lot of hospital systems force patients to play this game of phone tag between the patient access team, the clinic team, and the patient to see which appointment slots are available, see if they work for the patient, go back if they don't work for the patient. It could take 3 or 4 calls. So hospitals that have consolidated on scheduling systems and can expose those scheduling systems to, in this case, the chatbot, can actually make that experience much easier for the patient. They can do it all from the palm of their hand without picking up the phone and calling 3 people.
Yeah, and so it looks like they've suggested 4 p.m. with this provider. You know, unfortunately, that doesn't work for me in this instance, but I could see that if it did, all I would have to do is click yes, and I'm done. I can get back to whatever task I was focusing on and have an appointment set up. In this case, that doesn't really work for me, so I'm interested what the bot can do for me in that situation. And it looks like it's provided a few different time slots, which is great, and it's all instantaneous. You know, in previous experiences, I'm first not even sure which phone number to call. It's often a 1-800. I'm not sure which extension to pay attention to. And then I'm on hold or I'm getting a voicemail. I'm putting my phone away. I'm going about my workday. And then I get a phone call back. I need to rush outside to take the call, make sure I don't miss it, because who's to say when they're going to get back to me next? So the fact that this is all instantaneous is great. So it turns out mornings actually are better for me. It's provided a list of options. So I'm going to say 11 a.m. is really close to lunchtime, and that works for me. And with that, it looks like that appointment's been booked. It knows I'm coming. It knows all my information, like my address and my insurance provider from what I provided in the ED, and I can even save it to my calendar.
Yeah, and now that Kelly has the appointment booked, that referral flow has been successfully closed. Kelly has left the ED, and she will be seeing the doctor tomorrow.
Right. So we've gone from, I guess you could call a clunky, paper-based, small font experience to something that's much more seamless, automated, mobile-friendly.
That's right. And if you think about all those little things the chatbot did to help Kelly get to her PCP appointment, it was not necessarily just one conversation, but it could be several conversations that all happen on her phone. They're unobtrusive. She can experience them and engage with them on her own time. And the hospital system can now execute a referral program for all of the patients that have been discharged from the ED at scale, confidently, knowing that they can deliver this type of personalized engagement for each and every patient.
Okay, great. Well, this has been cool. Thanks, guys, for the walkthrough. This has been the Chatbot Roadshow.
Hope you've enjoyed this episode of the Chatbot Roadshow. You can find other hospital, pharmaceutical, and research solution demos in our resource library at lifelink.com.